I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
Brad, I think you got something here you want to talk to me
Yeah,
about.
Bob, this is not a six-pack of beer, although I wish it was.
Today's been a hot day.
Yeah, it was hot, yeah. Yeah, beautiful July day, and we were just doing some filming outside for wheelchairs, which brought to my mind that maybe we should talk about total knee replacement care.
Sure.
Okay, one of the biggest things for pain control and swelling control, total knee, is swelling and pain in that knee. How do you take care of it? Here we
Ice
go.
pack.
Cold pack, yeah.
Cold pack.
So you may need a towel, okay, a thin towel like so. And I actually have some varieties of cold packs to use. First of all, this is the most favorite cold pack that I have in the clinic. All the total knee patients and other people really like this Velcro knee pack. We'll get into it in a little bit more detail.
Sure.
But you don't need to spend, that's probably $30 to $40 plus shipping. I've had people order them because they like them so much, but you don't need them. You can simply go to our do-it-yourself cold pack and make some nice slush packs like this. And I keep these in my freezer at home for myself and my daughter and wife if we ever need them.
DIY cold pack. I think that's the title of ours.
Yeah.
Brad Heineck, physical therapist.
Okay.
Together we are the most famous physical therapists. By the way, it's interesting, Brad. I just had a patient yesterday just reminded me. And one of the things she was most upset about is that at one point she was in the hospital and she was having so much pain and she wasn't concerned about getting her medication. She was
Hi, I'm Bob Schrupp, physical therapist.
And together we are the most famous physical therapists on the internet.
Now, I've got another story. I had a patient come in, he's come in for rehab. He came in.
We got Brady here, he's at
at
University of Wisconsin La
2
Crosse.
bottles of rubbing alcohol. This is no kidding. He said, could you make me 2 of those cold packs? And he
No kidding.
He supplied us with their rubbing alcohol. So we did.
You had the formula.
Yeah. Oops. There we go. Now, why don't, the first thing you do is you can put a cold pack on your knee pretty much as you want throughout the day. Usually people will do it
After a knee replacement, you said.
right after knee replacement. You can put it on, every couple hours if you really wanted to.
Absolutely.
Usually 15 to 20 minutes in duration. And then if you got swelling especially, you're going to want to elevate the leg.
Along with it.
Right. So
Yeah.
why don't we do that in a supine position here. If you're in a chair recliner, you're going to recline the recliner back and you're going to put some pillows underneath your knee. And where you place the pillows to elevate it is critical, and the same thing is true in laying down in supine. So we'll go through that.
You want me to lay down?
Yeah, please lay down, but no sleeping.
I could use that.
Yeah. Couldn't we all? Okay, so this is going to be the new knee right here. It's left knee. We're going to elevate it. Now, normally you're going to need a few extra pillows. So Bob, you're going to have to go without a pillow.
Sure.
Now, the biggest mistake that people will do is they'll put the pillow right under the knee. And the person who had the knee replacement says, boy, does that feel good. Leave it right there.
Right.
But it's letting the knee in a flex position, and then you cool down in that position for a period of time after time. And it's going to minimize the chance is going to be for full extension. You want to have a straight knee when you're done. So even though it feels better up under the knee where it allows it to bend right here, it's not a big bend, but that's more than
You're really
enough.
not elevating the ankle here either. You're lowering the ankle.
Exactly. So you're going to bring the pillow back. Now this really isn't high enough. I would have
a couple pillows.
a couple pillows. What I'm going to do here, you could also fold it in here. And actually you may want to get it up to here. You may put 3 or 4 pillows under there. The other thing is, particularly with people that are more frail and their skin is more frail, you don't want to put a pillow or have right under the
Pressure
heel.
right under the heel.
Yeah, go from the ankle up because you can get a pressure sore, open sore in the skin, which you really don't want. You want to avoid. So there should be a gap under here, right here, and gravity is going to help pull that down to help straighten the knee, and then you apply the ice. Okay, the cold pack, cryotherapy as we call it in the PT world. If you got your homemade ones here, you're going to put one on top and
that feels good.
Feels good, doesn't it?
Yeah, it does feel good.
And most people in these are really happy to get to this part of therapy. The time to do this at home is after you do your exercises that your therapist or your doctor has given you. Now, a lot of people like to have a cold pack on the bottom side too.
Sure.
And then if you got it, you surround it, engulf it.
Yeah.
And then the best thing to do, I like to do anyways, I don't know what you do with your patients, Bob, but is I like to take an ACE wrap and wrap it around there and compress
We
it.
do the same.
Yeah.
it makes a big difference.
Sure. Now,
Which, by the way, Brad, to be honest, I've never used this ice pack before to do it yourself.
Right, right.
And these, you can tell they mold so well to the knee.
They're deluxe. I've given out recipes to hundreds of patients over the last 10 years with these, and they never get any negative feedback, unless they break. But they don't do anything.
Maybe Nancy, you can put a little clip of that video so that people can get to it real easy.
Now in the clinic, what we do is we got these nice cold packs that have Velcro on them, so you don't need the elastic wrap.
Sure.
Or the
It's
ACE
all in
wrap.
one.
Yep. Now, as a matter of fact, I wanted to show this video because I have people that like these so much they literally get the information, go on the website and order them offline. And I'll tell you where you get that if you want. But now this is real nice.
Ooh, that feels really good too.
Yeah, and it's soft, it's cushy, it's easy to get around, and works good.
I can see why people would like to order these.
You better believe it. Now the other thing is, a lot of people have, Bob's got skinny legs. After a knee surgery, there's a little swelling typically. And I would say at least 50 to 75% of the knees, when they first come out, this doesn't fit all the way around. So then what I do is I take another little skinny cold pack and put it in that gap. So they get complete cold all the way around. Not necessary, you don't really need to do that, but sort of those little things that can help. Yeah.
Just shows you how thorough you are, Brad.
Well, I like to keep my patients cool down when it's time to do that. Now, if you want to order one of these Velcro cold packs, this is the one to get right here, and it's through Salmon's Preston, and the number is 5258-02. I'll read that again. 5258-02. Order before midnight tonight. I'm kidding on that. But that is, if you go to Salmon's Preston's website and put that number in, that's the order number, and you'll be able to order one of those online. Or you can call their 800 number, which is on there as well. There's some shipping involved. You certainly do not need this whatsoever. Homemade ones work just as well. This is just a little more convenient. If you're going to have both knees done, one in January and one in June, then you might want to have them for later.
Even prior to having it done, just trying to cope with it a little bit longer.
Sure.
Put up with a knee.
Or if you're 40, 50 years old and your parents are getting their knees done, there's a nice gift.
Which leads
knee operation gift. That'd
Which
be fun.
leads me to our little spiel here, Brad.
Absolutely.
If you are 40, 50 and over, you're going to want to subscribe to us because we do provide you videos on how to stay fit and healthy and pain-free.
And get through surgeries like this that happen every day. So, I don't know, Bob, what else you got to say?
Nothing. We got the straight info.
I feel strong like bull today, Bob.